Let's talk about the spine for a second. Most people understand the importance of the spine because you look at the anatomy of the body, the brain is the most protected part of your body, so it put this built-in helmet, we call it a skull, protecting the brain. But then the second most protected part of your body is actually not your heart and lungs, it's actually your spinal cord. And the spinal cord is surrounded by bone just like the brain, except there's some joints in the back so you can bend and twist and move, and then there's holes on the side where the nerves can branch out and go connect your various organs, glands, blood vessels, muscles, and tissues to the brain so the brain can constantly communicate with what's going on throughout your body. Basically, the brain controls everything. So your spinal cord is the second most important part of your body. Now, are your teeth important? You're like, why are you talking about teeth? You were going to talk about the spine. Well, because most of us do a really good job of taking care of our teeth. I mean, how many of you brush your teeth at least twice a day? We all go to the dentist and see a dental hygienist twice a year, maybe more often, maybe every 3 or 4 months to get a professional cleaning of our teeth because we want our teeth to stay white. But also, we don't want any cavities. It's a big C word. Cavities can be very detrimental and we don't want those. So that's why we also get x-rays, right? Your dentist will x-ray your teeth most likely every 2 years, but sometimes a dentist will say, well, because you have such a history of so many cavities, I'm going to x-ray you every year or every 6 months, and those x-rays can catch those cavities before the cavity starts to hurt. So now, let me ask you a question. Are you doing a better job taking care of your teeth than you are of your spine? When was your last spine x-ray? Do you ever go to the chiropractor and say, hey, I just want a routine checkup and I want my spine checked and I want an x-ray just to see if my spine is doing well? You're like, well, that doesn't make any sense. No one told me I should get my spine checked. No one told me I should have my spine x-rayed on a regular basis. Well, because you probably haven't talked to a chiropractor before. Or maybe the chiropractor you spoke to was a pain management chiropractor focused on getting rid of pain. But when you talk to someone like a wellness-based chiropractor, a traditional chiropractor who is concerned about not just your pain, but the overall function of your whole body, that chiropractor understands and knows. And there's nothing wrong with the other chiropractor, right? Because they're good at getting rid of your pain. And sometimes that's all you care about. But the other chiropractor understands that how the brain connects to the rest of your body is powerful. All life force comes from the brain. That's why if I remove the brain, all function stops in the body. Eventually, nothing can continue to live long term. You can get a heart transplant and a lung transplant, and you can get kidney transplants and a liver transplant, but you can never get a brain transplant, and you can't get a spinal transplant. That cannot change. That's permanent. So your spine protects your spinal cord. An abnormal curvature in the spine will put tension on the spinal cord. Abnormal curves in the neck can reduce blood flow to the brain. A misalignment in the spine can lead to bone spurs, disc bulges, which becomes arthritis, which can become a permanent issue. Let me ask you a question. Is it possible right now I could have a tooth cavity and not know about it? I know you're saying yes, of course. Even though I brush my teeth regularly, even though I see my dental hygienist every 6 months and I get my x-rays every 2 years, there's a possibility I could have a cavity right now and not know about it. Why is it that I wouldn't know about it? It's because it doesn't hurt. See, a cavity at the beginning doesn't hurt. That's the first hallmark of a cavity. You don't necessarily feel it. Well, guess what? You literally could have a misalignment in your spine, what we call a subluxation, and you wouldn't feel it. You don't know it's there because you feel okay, because you don't know what the difference would be, because it's been there for a very long time, perhaps. Or it just happened, but you didn't think anything of it. You just felt some stiffness or tightness. You just ignored it, and the tightness went away, and you said, oh, I must be fine. But the misalignment stays, and it starts to degenerate. See, the second hallmark of a cavity is that if you leave it alone, it's going to get worse. It's going to decay. It's going to rot through the whole tooth. It's going to get into your gums and cause gum disease. It's going to spread to other teeth. It's going to get infected, and that infection can get into your blood called sepsis, and it can eventually kill you. That's what a cavity can do. A subluxation is very similar. If you don't correct it, then it gets worse. Eventually, it will cause pain. Eventually, it will cause dysfunction like numbness, weakness, and radiating pain, and it can be very serious. If you have teeth, you're susceptible to cavities. Would you agree? As long as you have teeth, you're susceptible to cavities. But guess what? If you have a spine, you're susceptible to subluxation and misalignment. Let's say there's a dentist here and checks my teeth and says, hey, Dr. Amir, you have a cavity right here in this one tooth. And I go, Mr. Dr. Dentist, don't worry about it. I'm on my way to the gym. I'm going to go pick up the whole gym. I'm going to exercise really, really hard. I'm going to live the wellness lifestyle. Now, are any of those things going to fix my tooth cavity? Absolutely not. Well, what if I have a misalignment in my spine? A subluxation. Instead of spine being straight, it's tilted or rotated or bent. And I go, well, I'm just going to take a pill, and that pill's going to go inside my body and move my bones and align them for me. Is that going to happen? What if I get an injection of some chemical into my spine? Is that injection going to go move the bones around? No. If you have a cavity, would you call a brain surgeon to come fix your cavity? Would you call a plumber or an electrician to come take care of your cavity? No, you go to a dentist. You're like, that's a dumb question. Yes, I agree, it is. But when we have a spinal misalignment, who should we call? See, a lot of us, we take a pill as opposed to talking to the chiropractor. The spinal misalignment can only be corrected by a specific adjustment. When's the best time to take care of that cavity? I heard you say it. The sooner the better, right? You don't want to leave it alone. You don't want to get worse. You don't want to cause all these other problems. Well, when's the best time to take care of a spinal subluxation or a misalignment in your spine that's interfering with the nerve system? Guess what? Same thing. The sooner the better. But you're like, but I feel fine. It doesn't hurt. Yeah, well, neither does your tooth. And you went and got your x-rays. So my suggestion to you, hopefully you'll listen to this, go and get a wellness checkup by a chiropractor who takes x-rays and analyze the spine. Look for misalignments that could lead to bone spurs and degenerative changes. It can make you age faster. It can make you be weaker. It can affect your quality of life. And I want you to enjoy life and live a long life, long, healthy, productive, vital, happy, active life, so you can see your children, great-grandchildren, and really do the things you love doing and do it for as long as possible. Take care of your spine. Keep watching our videos. Subscribe. Let us know what you think. Comment. We'll interact. I'll talk to you later.